Hi, and welcome to Humanity RX, where we are sharing stories that highlight the human side of healthcare and bringing you life lessons from the bedside. We are your hosts, Jenny,
Tovah,
and Jonathan,
and we're glad you're here. Our guest today is Dr. Jan Leyfman. And Dr. Leyfman, thank you so much for being here with us today. We appreciate it that you took the time to speak with us.
Thank you so much for having me. It's truly a pleasure and looking forward to our conversation.
Can you tell the audience a little bit about yourself, your experience in healthcare, and some of your accomplishments?
So I'm a U.S. trained physician and a translational researcher with a background in immunology, oncology, immunotherapy, gene therapy, and COVID-19. I'm also an educator, a mentor, a conference host, and a journal editor as well. I also have a passion for giving back, so I'm heavily involved in community service centered around mentorship, oncology, and global medical education.
And how did you get involved in healthcare? What inspired you?
So that actually is a story that goes back to my childhood. I am one of the few survivors of the after effects of Chernobyl from the largest hospital in the former Soviet Union. So growing up, radiation was everywhere. Now, although I was asymptomatic initially, I began to experience widespread symptoms by the age of 2, including symptoms of diffuse lymphadenopathy, weeping wounds, and cysts all over my body. I went from clinic to clinic, hospital to hospital, and really with no one being able to diagnose or much less treat me. And then in the largest and most advanced hospital in Belarus where I was born, I was the interesting patient, where doctors would really come from all over the country, look at me, but none could either diagnose or provide me any relief. And so eventually I was placed on palliative care with my condition deteriorating by the day, then eventually put on hospice. So I remember those feelings of helplessness essentially like it was yesterday. And I'm really grateful to my parents because for me, they are really what inspired me, but more importantly, what advocated for me to really get treatment abroad. And that's really why I'm alive today. I still remember that the medical staff's warm, proficient care not only really saved me, it also led me to find a purpose. An appreciation for medicine that really has continued to resonate throughout my training. Now, ultimately, I was actually the child that was never supposed to make it, but did. And I really never forgot what it's like to be a patient. And I'm really grateful to be alive. And so I live every day like it's my last. And I also live it in honor of the over 1,000 children that really couldn't or did not make it out. And really, so that's why I started to do research at the age of 15. As a means to give back. And I'm still involved in it until this day. Ultimately, I'm excited, have in the near future the same level of impact on the lives of my patients as the physicians who saved me.
when you were a child, because I work in pediatrics, so I'm so curious to hear the child perspective, and you remember everything so well from such a young age. Can you remember a specific person or a moment on that journey?
So a moment I'd like to highlight was I was fortunate to get treatment abroad. I was there for 6 months, then I came back, and then I got sick again. But when I was coming back and I was walking back to that hospital, something was different. I looked around. The parking lot was slightly different. And the reason why was because all the patients that were with me before I left had all passed away. And they buried them in the parking lot without a tombstone, without a name, without anything. And you would walk and you would hear bones crack under your feet. And I would look at my mom and I'd say, "What happened here?" And she looked at me with a very stern face, said, "Focus on your recovery. When the time's right, you'll know the story."
And your mom really advocated for you. And then I know later you got to advocate for her when she was sick. Is there anything that she's shared with you that helped her through that time? Because I can't imagine going through that with one of my kids.
I owe everything to my parents, especially my mom. She's probably the strongest person that I know and really the one that continuously inspires me. She gave up her career for me, stayed with me in that hospital just so that I wouldn't feel alone. I was an only child. Still am. Given the circumstances, she didn't want to have any more children and kind of put them through the same hardships that I had gone through. But she never gave up. She always believed. And she kept pushing and pushing and pushing. And really, the life lessons from that still inspire me. You know, although I'm an immigrant, I still live with an immigrant mentality despite being an American citizen. And really, I feel at this point, being in the country over 25 years, kind of, already assimilated. But I still never forget where I came from. And I still feel that's important because it makes me appreciate being here that much more with every single day, the opportunities, but also what we have, the therapies, the innovations, the access, something that really didn't and really doesn't exist in a lot of other countries.
Yeah. And that was my next question. Like, how did this experience shape the way that you view healthcare and the people that are involved in it, in your care?
So that's a very great question. So my experience keeps me grounded and constantly reminds me really what it is to be a patient, the fears, the uncertainty, the emotional, physical toll that patients face on a daily basis, especially in arenas where patients have a disease where we have limited therapeutic interventions. I make it a priority to anticipate not just the medical needs, but also the emotional, logistical challenges that patients may face. But that also extends beyond the individual, because as the patient experience also includes their family, navigating insurance, connecting them with resources to help with their care. And I'm fortunate to work with an amazing team, and I truly believe that teamwork makes the dream work, but also all the difference in really trying to achieve the best patient outcomes. And really, at the end of the day, my goal is to be there for my patients in every possible way so that hopefully they have a positive outcome at the end.
You've obviously been through quite this remarkable journey early on in your life, which you have a nice recollection of. And I know you've done or doing a lot of the COVID-19 research. And I was just wondering what was kind of going through your mind as in the early days of COVID-19, because some of the things you said resonated with me. I remember being in the hospital when we didn't know what to do with some of these patients who couldn't be extubated. And it was a very helpless feeling. And I was just wondering kind of early on, maybe how you wrapped your head around some of the things that was, oh my gosh, is this really happening, right? And just what launched you into some of that research.
So it's funny you say that. When COVID hit, in many ways, it was like deja vu. Every day, I would read the news and see what's happening. Now, I was in medical school at the time in Pennsylvania. I live in New York. My family lives in New York, and my parents are actually on the front lines. So to me, it was also personal because I needed to make sure that they were safe. It's funny because in many ways, just sitting at home, I began reading more about it. I really wanted to help because what was happening was literally just like deja vu in living in Belarus several years after the Chernobyl nuclear disaster. Just this mysterious aura attacking the world, people falling left and right, being hospitalized, and no one really knowing what tomorrow's going to hold. So it was a transformative experience, and one which really taught me you're more capable than what you imagine. And sometimes you have to be thrown into the fire and come out stronger than you've been. Maybe a bit crisper, but stronger at the end of the day.
I'm curious if you could go back and give yourself some advice. What do you think you would say, knowing what we know now?
So really, to my younger self, really anyone listening who might be going through some tough times, I just say keep pushing forward. Even when you don't see the path, trust that it's there. And more importantly, never stop believing in yourself. You're more capable than that of which you think you are.
You really bring an interesting perspective that you can look at disease from so many different perspectives. And maybe that's a superpower you have. But, I often think like, wow, if every healthcare provider went through an experience to be a patient, we'd all be better. But of course, I don't wish that on anybody. If you can speak for a second about how the perspective of how you see, you look at disease from a researcher perspective, a physician's perspective, a patient perspective. I'm not sure if caregiver perspective is in that resume for you or not. but just wanted to just highlight that for us, if you will.
So I guess my journey is unique because I actually saw it from all of those perspectives. I used to be a caregiver for my mom when she was diagnosed with cancer due to the side effects of Chernobyl. I got to see how challenging it is for a patient to navigate the healthcare system who was not in the healthcare field, but equally important, the challenges of dealing with insurance. I had to learn what it was like to be a patient navigator before knowing what a patient navigator was. And here was I still in college, a bubbly, enthusiastic person, looking forward to hopefully one day joining the medical field, and then seeing the challenges that patients undergo, how difficult it is to be connected to care, battling with insurances to get even a patient in insurance after one drops her, and then trying to find a physician that also takes her insurance that then would also be willing to take a patient whose treatment was started by a different physician and then willing to take over their care. And really, the fact that if you haven't lived through it, it's hard for one to really empathize with the patient. But I think I've seen the medical field from a lot of different perspectives. And it's those perspectives that I feel that have molded me and keep me grounded at the end of the day. And so I believe that medicine is a team sport. It's not just the staff that you have in the hospital. It's also the family that you have close by. Especially in your hardest of times, you're leading on to your family for decisions. And I feel that it's equally important to keep them updated. But also, I like to take it one step further. I'm a proactive rather than a reactive person. So I like to have a plan B and C and D and E, and just because I feel that gives people reassurance. If you're a patient, especially when you're dealing with a rare disease, or if you're undergoing treatment and you're not getting the expected response, you want to know that there's a plan B. That otherwise you're not going to be sleeping much at night. So
I'm going to say your patients are so lucky.
Yeah, they are really lucky. And it makes me think, because I know you do a lot of mentorship and raising future healthcare leaders, and it's different to walk through something and develop that empathy than to impart it to somebody who doesn't have that experience. And so I'm just wondering how you infuse that into the people that you're mentoring.
So during the height of the pandemic, Dr. Park and we built a platform to combat medical misinformation called MedNewsWeek. And so we built up this platform. We now reach over 100 countries, 33 of which have lower socioeconomic status, and all of our content is free. And we strive to make it to a mainstream level so that anyone can learn and appreciate. And we host global leaders in medicine on a bi-weekly basis, speaking about the latest developments in the field. And it's really the people who are there and writing the guidelines for care for a lot of medical conditions. As a part of that, I also realized throughout my medical journey that mentorship is rare. And really, it's an all-encompassing word, but there's a spectrum. And having had varied experiences, I really felt like a part of what we do also has to be to really train the next generation of leaders. And so we're fortunate that we have about 22 trainees globally in all stages of education, all the way from the high school level to college, to medical school, to residency, helping us, to build up and grow this platform. And I want, and this is all on a volunteer basis, that the most important thing that they can do is really invest their time. But what they're doing is they're leaving an important footprint, a footprint that there could be just this one patient sitting in a country without the resources and listening to a show that they helped to co-host with one of the global leaders in the field about a condition that they have. And maybe that leads them to have hope. But equally important, maybe there's a clinical trial that they could be eligible for that they just didn't know. And then that leads to them reaching out and eventually being connected and hopefully their lives being saved. Unfortunately, a lot of our mentees are actually from redeveloping and developing countries. And so they have that perspective of the care that's available in their countries And then when they come to the US to do rotations or research, they realize and they see what a dichotomy there is. Having been born in one country of similar stature, I realize what that's like. And I really feel that what we can do can transcend us being close to one another. And really, the magic of the internet has, I feel, transformed how we look at care, how we look at collaborations, how we look at research. And there's a lot of talent out there. They just aren't being given the opportunities. And if I can be someone who can be a bridge to that, that's equally important than any legacy that I can leave.
Can you tell people how they can access MedNewsWeek?
MedNewsWeek.com.
We encourage everybody to take a look.
You are a great resource for a lot of information, and just want to have you leave a takeaway, if you can, to the audience, which may be made up of healthcare providers, caregivers, former patients, current patients. Like, what is your prescription for humanity, Dr. Leyfman, that you would want to impart to our audience?
So when I look back in my journey, I realize how much it has shaped not just who I am, but also how I approach the medical field. Having been a patient myself, I never walk into a room without asking, well, if I were in that patient's shoes, how would I feel? And really, what can I do today to be better than I was the day before? And really, that's a perspective that I carry with me every single day. And essentially, I view it as a growth mindset. I'm proud of the research that I've done, but at the end of the day, it's really the human connection that matters the most. I've also had the incredible privilege of working with a team that's saved my mom as well, contributing to research that led to new treatment recommendations for a rare cancer. But really, beyond my personal story, I'm driven by something bigger. I really want to be a vehicle for change to make sure that patients don't have to suffer the way that I did as a child, or the way that so many others have. And that's really why I'm constantly pushing myself to grow, to learn, and to seek out mentors who can really help me reach that next level in my career. But at the same time, I'm equally passionate about giving back, whether it's fighting medical misinformation through MedNewsWeek, to mentoring the next generation of medical trainees, to working with nonprofit organizations like Music Beats Cancer to fund startups that will hopefully give rise to the next wave of innovative cancer treatment. I really want to leave an impact. And more than anything, I really want to honor those who didn't get the second chance that I did. And I truly believe that I was saved for a reason, and every day I try to live up to that purpose.
Thank you for being here, for sharing your story, and thank you everybody for tuning in. We hope you join us next time.
Thank you for listening to Humanity RX. We hope today's conversation gave you something to think about and maybe even feel a little more connected to the human experience. To find out more about our guest, please find more information in our show notes. Humanity RX is created, written, and produced by the three of us, Jenny, Tovah, and Jonathan. If you enjoyed this episode, we'd love it if you subscribed, left a review, or shared it with someone who needs a little dose of humanity. You can find us on Instagram at HumanityRxPod or LinkedIn at HumanityRx. Until next time, be good to yourselves and each other.